Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. Do you know what's going on in this little cartoon here? It's just a little depiction of fiber network and a blood clot forming. We're going to be discussing vascular pathology in this presentation. This is covered in your book, Medical School Pathology and Step 1 Review. So this presentation here is going to just touch upon some key things that you should know. This is an overarching introduction to the pathology associated with vessels, okay? Key take-home points to know about vascular pathology include vasculitis, hypertension, atherosclerosis, aortic dissection, aneurysms, vascular tumors, and valvular disorders. Okay, so it's a lot. This is just an introductory to get you primed, okay? Regarding vascular pathology, the blood and lymphatic vessels that circulate the blood throughout the body, circulate the lymph as well, make up the vascular system. And this is actually known as the circulatory system. It's very important. Blood is transported by the arteries and veins through the body, feeding and nourishing the tissues and eliminating waste from the cells, right? That's how we get oxygen to our organs and in tissues. On the other hand, lymphatic fluid is transported through lymph vessels. It's a clear, colorless fluid containing water and lymphatic fluid. The lymphatic system contributes to the preservation and defense of the body's fluid environment by filtering and expelling lymph from every part of the body. It's very important. Now, this image here to the right is a cross-section from a patient that has giant cell arteritis or temporal arteritis. Do you know how they may have presented? If you're thinking an older person, maybe with headaches and visual disturbances, then you're on the right track, right? This is just a primer. We're going to talk about this and much more as we hit those following lectures. Regarding vascular pathology, the blood circulatory system's vessels are as follows. Arteries that deliver oxygenated blood to the body from the heart, veins in which blood arteries that return blood to the heart from the body, I should say blood vessels that return blood to the heart from the body, and capillaries, which are tiny blood capillaries that carry oxygen-rich blood throughout the body between arteries and veins. This is where the oxygen diffusion occurs. Blood is pumped from the heart and circulates throughout the body, right? That's 101 stuff. The oxygen content of the blood when it leaves the heart through the arteries is high. In order to provide oxygen and other nutrients to the cells of the body's tissues and organs, the arteries divide into smaller and smaller and smaller, progressively smaller branches. The oxygen and other nutrients enter the cells when blood passes through the capillaries, while waste products from the cells move into the capillaries. The veins that bring the blood to the heart expand as it passes through them when it leaves the capillaries. The vascular system serves as a key part of various physiological systems, in addition to transporting blood and lymph throughout the body. What are some of those symptoms, you say? Well, blood pressure regulation is a big one. The coagulation cascade is a big one, right? So there's these other systems. Examples comprise the respiratory apparatus, mechanism for digestion, the urinary system and kidneys, even temperature management. Regarding the respiratory apparatus, carbon dioxide is expelled and oxygen is taken in as blood passes through the capillaries in the lungs. Through the lungs, the body releases carbon dioxide and the blood transports oxygen to the body's tissues. Regarding mechanisms for digestion, blood passes through intestinal capillaries during digestion and carries nutrients including glucose, vitamins, and minerals with it. The blood delivers these nutrients to the body tissues. Regarding the urinary system and kidneys, the blood is filtered by the kidneys to remove waste products from the body tissues. The bodily waste then emerges from the body as urine. With regards to temperature management, the circulation of blood throughout the body helps the body's temperature to be controlled, right? We want to maintain homeostatic levels. As the body's tissues go through the processes of converting. Now, what is vascular disease? Well, a condition that affects the arteries and or veins is referred to as a vascular disease. Vascular disease typically impairs blood flow either by obstructing or weakening blood arteries or by causing them harm to them or even the vein valves. Vascular illness may cause harm to organs and other body parts by reducing or even obstructing blood flow. Now, what brings about vascular disease? Well, vascular disease has several causes, including atherosclerosis, right, plaque buildup, emboli, thrombi, inflammation, right, like those vasculitides, and even trauma. Here in this micrograph, we have an image of a large body having a foreign body emboli as a result of immobilization prior from a nephrectomy due to renal cell carcinoma. Interesting. This image is just showing a common pathology known as a hemangioma, specifically a cavernous hemangioma. Note all the dilated spaces filled with red blood cells. And here is a juvenile hemangioma seen on various young patients. Now, despite its appearance, it's actually a benign condition. So some examples of vascular diseases and the negative impacts include as follows. You can pause and read this, or you can listen to me. Either way. Cardiovascular disease, so like cardiac arrest. Yeah, let's do this. Let's do this. Cardiovascular disease. Okay. Patient with chest pain, right? STEMIs, right? Angina, all that sort of stuff. Cardiac arrest, angina. Vascular diseases can impact the brain. That's how we have cerebrovascular disease, such as a TIA or an actual full-on stroke. Peripheral artery disease, in which peripheral arteries are obstructed to the point where downstream tissues are deprived of oxygen, such as the case in critical limb ischemia or claudication. There can also be vascular diseases of the great vessels, such as an abnormality like coarctation of the aorta or a aneurysm. Peripheral venous disease, like in typical elderly woman who has these enlarged veins on their lower extremities, those varicose veins. Or, like we talked about earlier, our friend who was flying cross country or driving in the trunk, elderly man carrying a little extra weight, a DVT, deep vein thrombosis. There's also lymphatic vascular diseases such as lymphedema. Vascular diseases of the lungs, which include granulomatous with polyangiitis, or just angiitis, or vasculitis, or hypertensive pulmonary vascular disease. There's also renal vascular disease like fibromuscular dysplasia and renal artery stenosis. Which one of those would be bilateral? Renal artery stenosis typically. and fibromuscular dysplasia, would that most likely affect a male or female? Female, right? There can also be genitourinary vascular diseases, such as erectile dysfunction due to vascularity issues, such as impotence. Numerous medical specialties handle vascular disorders and diseases because they may simultaneously affect multiple bodily systems. Now, to ensure that patients with vascular disorders receive complete care, specialists in vascular medicine and/or surgery collaborate closely with physicians in other fields, including internal medicine, interventional radiology, pathology, cardiology, and many others. So, we've completed this overview. In subsequent lectures, we're going to go into more detail on those various pathologies. Hold on to your hats. It's going to get real bumpy. But I know you got this because you're so smart. You're making me proud. You're making your family proud. Everyone's so happy with what you're doing. So happy. Keep up the good work. Keep studying. Add to your knowledge base. Now's the time. Make sure you're using your book. And I'll see you later.